Hello everybody, this is Jenner Argueta and today we are going to review some details related to the poster that the participants will send for the Saving the Natural Tooth contest that Meta Biomed just launched internationally. Every participant will receive a template similar to this one in PowerPoint. This template have the main areas that have to be covered during the clinical case presentation. This template have a title. This title should not be changed. There is a space for the name of the participant, the name of the dental office if it is a private practice, and the name of the university if the participant teach at a university. Here is a space for a picture, and there is also space for the logo of the university or the logo of the clinical practice. Going to the areas that have to be covered during the clinical case presentation, it is a space for a case introduction. In this space of case introduction is advisable to place all the details related to the pulpal diagnosis, periapical diagnosis, or all the reasons that took the tooth to a stage in what it was needed to receive a root canal treatment. All general details that you want to point should be considered to be placed in this area. We have a space for a preoperative radiograph, and we also have a space just beside the space of the preoperative radiograph for a post-operative radiograph. What to write in the description is totally up to the participant. You can describe the interesting details of the radiograph or of the picture. Then we have a space designated for 6 pictures or radiographs. In these pictures is important to describe the basic sequence that the root canal treatment had, and you can choose the most interesting parts or the most challenging stages of the treatment when you were performing that. In this case as well, every picture or radiograph should have a description, and in the last one is important to have a follow-up radiograph. It is advisable to have at least 3 months follow-up radiograph. In this way, we will be able to show that our root canal treatment is working and performing well on the patient. It is advisable to have a clinical case with a final coronal restoration, because as you know, the coronal restoration is the treatment that will provide the coronal sealing. Without that coronal sealing, the root canal treatment will fail at some point in the future. At the end, we will have a space to describe the clinical procedure and the materials that were used during the treatment. In this case, you will describe the stages of the treatment and the materials that you use. All the materials from Meta Biomed that you use should be mentioned in this area. We also have a space for a clinical discussion and the conclusion. You can cite articles in this area, and if you want to provide a personal conclusion, you can do it as well. It will depend on the participant. And now let's review the case that I present as an example. So I decided to have this picture in my poster. Here is my name, Jenner Argueta, and I have the name of my dental clinical practice, my personal logo, and the logo of my clinical practice. In the case introduction, I describe the reasons of why we needed to do a root canal treatment in this first upper molar. This first upper molar was sent by the referral doctor because the patient started reporting pain a few weeks after the placement of this zirconia crown. Our diagnosis was a pulp necrosis and symptomatic apical periodontitis. The referral doctor asked us to please do the root canal treatment through the crown because they didn't want to change the crown. So we proceed in that way. This is the preoperative radiograph, and this is the immediate post operative radiograph. We were able to achieve an acceptable working length in all the canals, and then we have the pictures related to the sequence of the treatment. The main challenge of this case was to work through the coronal restoration and to be precise enough to get inside of this constricted pulp chamber. We started with the complete isolation with rubber dam, with the clamp. As always, I use NextTemp LC, that is a flowable dam. This material have multi-purposes in endodontics. And then having in mind the mesiodistal and the bucopalatal dimensions of this molar, we established a point to go inside, and we managed to went straight into the pulp chamber. As you can see, we can observe some necrotic tissue in this area. We started negotiating the canals. One of the interesting parts of this case is the root canal system in the mesiobuccal root, because we managed to clean and shape the mesiobuccal canal. Then we were able to clean and shape the MB2, but after we locate a third entrance to that mesiobuccal root canal system. I won't say that we have 3 canals in the mesiobuccal root, because most of the times they are just entrances to that root canal system that might be very complex inside. The high cyclic fatigue resistance of Aurum Blue is very convenient, because with conservative access is not possible to go inside of the root canal treatments in a straight way. Then we proceed with the root canal obturation. In cases with conservative access, sometimes it's difficult to do a root canal obturation with the lateral compaction technique. Sometimes it's difficult to take the devices for performing a thermoplasticized obturation technique in an appropriate manner, and the obturation technique using calcium silicate endodontic sealers is very convenient. In this case, we decided to use CeraSeal with a master cone that serves as a carrier also for taking the root canal sealer inside of the roots for achieving an acceptable root canal obturation. We are able to see here that we have an obturation of the mesiobuccal root, 1, 2, and 3 entrances, and in this view we have the palatal canal, the distobuccal canal, and the most palatal area of the mesiobuccal canal. In cases where the practitioner decides to go with a conservative access, one of the most difficult parts of the treatment is to fill the pulp chamber. We decided to use NextComp Flow. NextComp Flow is a flowable composite from MetaBiomed as well, and we use this material to fill the pulp chamber. After the NextComp Flow, we decided to place some MD temp, and we send the patient back with the referral doctor and ask him place the final restoration on the endodontic axis. At the end, we have a 6 months follow-up radiograph. As you can see, the crown looks well adapted, the patient is totally asymptomatic, and there is no radiographic evidence of disease. So the follow-up is not so long, but is an acceptable follow-up for this contest, and we can see that our treatment is working good. This case is going to be interesting in the future, because we will have the opportunity to compare the behavior with this implant that hopefully will be restored soon with the behavior of this natural tooth with a root canal treatment and with a well-adapted coronal restoration. In this area, I decided just to explain with more detail what material and what devices I use, and in the case discussion and conclusion, I decided to express my personal opinion related with what are the most challenging stages of the root canal treatments in cases like the one I just present to you. What we want during this contest is to see how passionate you are when the time to save the natural tooth arrives to your office, and all the effort that you expressed in every single treatment, and how you take care of every detail during the treatment. So if you have any doubt, if you still needing more information related to the way of presenting the case or the requisites, just please send us an email and we will be able to help you to achieve a good result during your clinical case presentation in this poster. So to finish this small presentation, I just want to invite you to keep the hard work and to keep saving the natural tooth every day in your clinical practice. Have a great time saving the natural tooth.